Welcome to Medical Assisting, Administrative and Clinical Competencies. For today, we will be discussing floor management priority table, positive personal qualities, and demonstrating professional behavior as a medical assistant. The floor management priority table. The first priority, assisting the provider with emergencies and procedures. Second priority, rooming patients. Third priority, performing procedures and dismissing patients. And the fourth priority, working on pending files that have tasks. Let us now discuss in details this priority table. The first priority, assisting the provider with emergencies and procedure. We have to learn to anticipate. When a patient might need a special procedure performed is a good skill to cultivate. The medical assistant can save time by preparing items necessary for the procedure ahead of time. But do not open any supplies until a direct order is given to perform the procedure. That is the first priority, assisting the provider with emergencies and procedures. Second priority, rooming patients. When a room becomes vacant, clean and prepare it for the next patient. Retrieve the patient from the reception area, document the patient's chief complaints, and perform vital signs. Try to stay 1 to 2 rooms ahead of the provider. The provider should never have to wait for the medical assistant to room a patient. That is the second priority, rooming patients. The third priority, performing procedures and dismissing patients. And the fourth priority, working on pending files that have tasks. Like, for example, calling back patients with test results, calling in prescriptions per the provider's orders, and so on. These are the four floor management priority table. Assisting the provider in emergencies and procedures, rooming patients, performing procedures and dismissing patients, and working on pending files that have tasks. The positive personal qualities of a medical assistant. First is a friendly attitude. A through concerned, caring viewpoint, your attitude can be your greatest asset or your biggest stumbling block. A good attitude has to be cultivated and nourished. Having a good outlook on life carries over into every area and promotes a general well being. That is a friendly attitude. The next one is a genuine smile. A genuine smile conveys that you acknowledge others and are interested in being of service. And the third one is perception as a professional. To look your best, you must be in good health. This means that you practice what you preach and have well-balanced diet, get plenty of rest, and avoid smoking. These are the positive personal qualities of a medical assistant. Demonstrate professional behavior. To demonstrate professional qualities in all aspects of your position and thus be respected as reputable medical assistant. First, exhibit dependability and punctuality by being on time and following through with what you say you are going to do. Supervisors, peers, and patients need to know that they can count on you. If you are constantly running late or not following through with prearranged commitments, other feels that they can trust you. Number 2, display a professional appearance. Your uniform should be clean, free of wrinkles, and include appropriate under attire. Hair should be clean and tied back if applicable, and jewelry should be kept to a minimum. Hands should be freshly washed between each patient, and nails should be clean and short. Number 3, engage in active listening skills during all encounters. Good listening skills improve the communication process. Number 4, demonstrate empathy. Putting yourself in the place of others and having an understanding of how they may be feeling or what they may be going through will allow you to provide comfort and genuine care to the patient. Number 5, exhibit a positive work ethic. A positive work ethic tells both patients and coworkers that you enjoy your line of work and helps build respect for you as a professional. Number 6, display sensitivity when working with colleagues and patients. Patients and coworkers feel you really care about them when you are sensitive towards their feelings and you conduct yourself in a positive manner. Number 7, demonstrate courtesy to patients and coworkers. Never interrupt someone when he or she is speaking and be alert to things you can do for patients and coworkers that will assist them in times of needs. This also helps others have respect for you. Number 8, display tact in dealings with patients and others. Being tactful assists others in receiving messages that might otherwise be awkward. Number 9, adapt to changes when necessary. Unexpected changes are common in healthcare. Being flexible assists you in being a good team player. Number 10, remain confidential at all times. Divulging confidential information can lead to distrust, loss of respect, and possible fines concerning patients' confidentiality. And number 11, demonstrate the principles of self boundaries. Knowing the principles of self boundaries or scope of practice of the profession is essential. In general, medical assistants cannot examine, diagnose, or prescribe treatments. These are some ways to demonstrate professional behavior as a medical assistant. Let me give you another rundown. Exhibit dependability and punctuality by being on time and following through with what you say you are going to do. Display a professional appearance. Engage in active listening skills during all encounters. Demonstrate empathy. Exhibit a positive work ethics. Display sensitivity when working with colleagues and patients. Demonstrate courtesy to patients and co-workers. Display tact in dealing with patients and others. Adapt to changes when necessary. Remain confidential at all times. And demonstrate the principles of self boundaries. Thank you for joining me in today's lesson. This is Reggie Capili. Please click like, share, and subscribe this channel. Class dismissed.